Great. Well, good morning. My name is Kevin Lewis. I'm the CEO of Maine Community Health Options. It's a pleasure to be with you here, which is our hometown as well if you have your business right here in Lewiston. If you know Storehouse number 2, or if you know Da Vinci's, you know where we are. And happy to have you stop by, make an appointment. We've had many people come by to explore their benefits, and that's what I want to do with you here today. We are the new nonprofit health insurer. As mentioned, we are on the marketplace along with Anthem, and we're really pleased to have gotten our start offering coverage and benefits as of January 1st. So we provide all of our support right here in Lewiston: member services, provider relations, our care management, behavioral health integration. We have side by side with our medical benefits, and I'm going to get into some of these details as we go. I think, and Wendy asked if we would focus on our key differentiators, given the short period of time, and we can get into some more Q&A here afterwards. One of the big differentiators, in addition to being a nonprofit, is that we have a member-led organization. So as a co-op, our members, and they include all of the employees of any small group business, have the ability to vote for the board of directors, and more than half of the board of directors have to be members of the plan. So there's great accountability back to the members in terms of how premium dollars are spent. In addition, all net revenues have to be plowed back into reducing premiums in successive years, as well as enriching the benefits of the plan. Another key differentiator is that we have every single hospital in the state in our network. It's a PPO plan. We also have a network that includes border facilities. I know that's important as we get further west and south. And then we have a national network as well. So in terms of travel, in terms of people who need to leave the state either for work or pleasure, we have that national network at your disposal. And there's no referral needed for a specialist as a PPO. Do you want to call attention to that? In terms of the small group offerings, we have 7 in total, 5 on the marketplace and 5 off. The 2 that are mutually exclusive are on the left-hand side here, the bronze level plans, and they really are differentiated by the deductible level. So on the marketplace, there was a requirement, unless one was able to secure a waiver, to have a $2,000 deductible for any plan, as a maximum for any plan on the marketplace. And that's why you see in the 2 middle columns, Community Select HSA and Community Select, they're on the marketplace with that $2,000 deductible. Because they're bronze level plans with an actuarial value of about 60%, you see that the co-insurance increases quite a bit. Off of the marketplace, we have both the HSA and non-HSA bronze plans with deductibles that are more standard without kind of actuarial value. And so you see that the co-insurance down at 50%. Something else that differentiates all of these plans is that we have a single deductible level for both medical and pharmacy, or for all benefits, including pharmacy, as well as a max out-of-pocket. It's a single max out-of-pocket for all benefits, including pharmacy. Down in the lower part of the graph, you see under physician, preventive care, office visits for primary and specialty care, and urgent visits. Another thing that we've instilled in our plans is greater transparency, so people know when they go in to see a primary care physician, for instance, exactly what the payment's going to be. So we pushed as much as we could into co-pays as opposed to deductible co-insurance for the kind of standard visits and where people spend most of their time and dollars in terms of utilization of healthcare on a day-to-day basis. Something that's not a differentiator is the piece on preventive care. I call attention to that because I hope everybody's aware of the array of preventive benefits that have been in existence for a couple of years now at $0 cost share to the members. So this is standard across all qualified health plans and something that everybody should be taking full advantage of. No, so thank you for that clarification. So we have 5 on and 5 off the Bronze plans in the middle are those that are on the Select, Community Select. And then the Silver plans and the Gold plans are also SHOP. And then off SHOP, we have the 2 Bronze, Community Option, plus the 2 Silver and the Gold. So the colors, sorry, it's kind of a coincidence. The Bronze and the Gold are close enough in color here that they look to be somehow grouped together. But it's 5 on and 5 off, and the 2 that are mutually exclusive are the Bronze Option versus Select. And what you will find, and I'm going to get back to some more specifics with regard to the actual selection process, but we have a great online tool that you can step through yourself or with your broker that will generate this kind of comparison at the end in terms of the products available to you and your employees at the different price points from least expensive to most expensive, and the benefits are rated accordingly. In each one of these, you can drill down into the summary of benefits coverage that Mitchell mentioned earlier, the 8-page form and other detail. What you'll find in that detail across all of our plans is that focus on integrated behavioral and medical health. So the first 3 visits to a behaviorist, whether for mental health or substance abuse treatment, is at no cost share to the member, and that's across all of our plans. We are dedicated to reducing the barriers to accessing behavioral health care. We also support same-day service, so that those warm handoffs can occur, whether it's within a primary care setting or elsewhere. And we also have, as mentioned, our behavioral health staff co-located with our medical, so that there is that integration within our own operations. We have a keen focus on member engagement. I'll speak to in a little bit more in just a minute. Something else to point out is our therapies, PT, ST, OT, are at the same cost share level as primary care. So if you remember those co-pays, $45 typically for a Bronze. One of the Silver level plans is at $20, also at $25 for the Gold Community Advantage. We set the same cost share, the co-pays for therapies, because we want to encourage people to access those services and get back to work, get back to normal as soon as possible. The biggest differentiator is our value-based insurance design, and I'll speak to that in just a minute. So in terms of wellness, we go beyond a nurse call line in the sense of having 24/7 access to health coaches, as well as having a very rich array of information on our portal, which is supported by Health Dialogue. And they have a significant presence here in Maine with an office in Portland. We don't rate differently for people that smoke versus those that do, while recognizing the tremendous impact that smoking can cause on long-term health and certainly healthcare costs. Instead of trying to put in place a premium differential, what we've done is make significant services available at no cost to the member to get people into treatment and to kick the habit when they are ready. So if you look at the middle part of this slide, you see that generic nicotine replacement therapy and Chantix are all available at no cost to the member. We also have tobacco cessation education and counseling also at no cost to the member. So the Chronic Illness Support Program is what we call our value-based insurance design. If you've heard of VBID in the past, you've probably heard of value-based insurance design with respect to prescription drugs, certainly with respect to self-insured programs. As a fully insured suite of products, we're really proud that we were able to bring this to market this year, focusing on 4 chronic conditions: hypertension, diabetes, COPD, which includes includes emphysema and also asthma. For these conditions, there is no cost share for an array of services that help people stay on the right side of their disease. So going beyond simply providing support, we wanted to provide financial wherewithal for people to stay current with their care management. So the $0 to take diabetes as an example here, $0 cost sharing for office visits, for certainly generic drugs, the diabetic eye exam, and the DME, the glucometers, the test strips necessary to manage the disease. Yes, yes, ma'am. Right. For right now, diabetes, asthma, COPD, and hypertension are the only diseases of our chronic illness support program. So to take to show you the illustration of how this would impact a person's cost sharing throughout the course of the year, for a person with type 2 diabetes, the sample care costs are in excess of $4,000. But for this community choice, a silver level plan, the patient would pay just over $200 in out-of-pocket spending for the entire year. So that's a dramatic drop from what they might otherwise be paying. I wanted to give you a sense of our enrollment on this small group, but first to give you a comparison in terms of all enrollment, and this was about 10 days ago when the snapshot was taken. It's a pretty good, diverse array of subscribers across the state. So we're pleased to see that we've been taken up throughout Maine. When we look at the small group enrollment, it's a small percentage of that total, and I think reflects what Eric said in terms of the small group trends, and also what we're seeing in individual and family, and small group moving towards individual and family. But here we also have a wide distribution of that enrollment across the state. The average age for the small group enrollment is quite a bit younger than the individual and family, or our total enrollment, at 37.84 years, as opposed to about 45 years for our enrollment overall. And it's spread pretty evenly across the age spectrum. In terms of plan distribution of enrollment, we were surprised to see a much greater take-up of the Community Advantage products versus the bronze. After Community Advantage, the silver level plans are the most popular at this point. And here we have a geographic representation of the enrollment by product. Again, fairly well spread out, except, of course, for those that have the fewest numbers. And here we have, it's interesting that we have half and half in terms of female-male enrollment. Subscribers almost outweigh child and spousal coverage by 2 to 1, not quite, but getting close. That was a surprise, too. I thought we'd see greater numbers in terms of dependent and spousal coverage. And then the plan representation, as just mentioned, Community Advantage Gold being the most popular. So quickly, we have a very easy 7-step process through our website that can walk you through plan shopping, comparison, selection. It starts with some basic information about the company, your full-time employees, as Roger was mentioning earlier, the FTE and the wages, and also a couple of questions to help indicate whether the SHOP tax credit would be applicable. Next, filling out the census, and then moving to actually looking at the benefit choices. And here you can get into specifics that some of which we've talked about. And then what is the contribution level of the employer in this overall plan design. And there's some ways to drill down into assistance or help in determining that. And then back to what we saw earlier, the array of plans with the attendant premiums based on your census and the answers to questions you provided earlier. And lastly, a proposal review with some comparisons based on what you've selected. So all of that is really at your fingertips, and then beyond that, an ability to manage your coverage through our portal and with the support of our business development team and the account managers. And I think with that, I want to make sure that I introduce my colleagues that are here. So Joyce McFeatris is our Chief Human Resources Officer. Scott Tagersel is our Director of Business Development. Bob Garrett is one of our account managers. Bob's over there, thank you. And Mary Whitaker, also an account manager. So feel free to ask any questions, and we'll be happy to engage with you now or after the forum.